Metaverse against mood disorders. Towards an immersive teleclinic in psychiatry for the elderly.
It is Thursday, January 23, 2031. Philippe Dubrail, 75 years old, lives on the outskirts of Nantes in Carquefou. A retired logistics technician, he feels good in his neighborhood. His wife Valerie was a teacher. She died in a traffic accident, leaving Philippe a widower for nearly 19 years now. They had 2 daughters born in 1981 and 1984. Laura, now a painter, has been settled in New York since 2015. Amélie lives in Nantes, where she is a beautician. She helps her father whenever she can free up some time. Philippe also has a dog, Diego, whom he walks morning and evening.
3 months ago, Philippe had a fall and had to be hospitalized. Diego was placed temporarily with a foster family, as Amélie could not take him into her apartment. During the 10 days of his hospitalization, Philippe gradually recovered, but a terrible fear of falling prevents him from walking and even from getting up. He was able to meet a psychiatrist, Professor Samuel B., who assessed his mood and anxiety, and spoke to him about a possible psychomotor disadaptation syndrome. Professor Samuel B. prescribed Philippe an antidepressant, sertraline, as well as support within the virtual unit of the Resource Center for Psychiatry of the Elderly UVCRPPA of the Nantes University Hospital.
Later, Philippe goes by ambulance to the Resource Center, where Samuel B. receives him and introduces him to members of the multidisciplinary team. He first meets the psychologist, Maeva, who, following an interview, helps him create his avatar. Then Arnaud, the nurse who will be his referent in the program, presents Philippe with a headset that the center will lend him. He shows him, in particular, how to handle it to connect to social virtual reality. Philippe is also assessed by the psychomotor therapist, Lena, before meeting the neuropsychologist, Miss Sunshine. At the end of the day, the multidisciplinary team discusses the therapeutic options that will be proposed to Philippe.
Back home, Philippe improves his avatar. He personalized it so as to show elements that characterize him. Amélie has set up a meal delivery service, but Philippe doesn't have much of an appetite. In the weeks that follow, he nevertheless carries out the activities planned in his program, which includes interviews, supervised assessments, autonomous exercise times, and group therapeutic activities. It is during his mid-program review appointment with the psychiatrist that he looks back on the previous week's activities.
Monday. Memory stroll. Philippe has an appointment with Maeva. She receives him in her virtual office. Then they teleport to a digital twin of Tréguier where Philippe and Valerie used to regularly spend their summer holidays. The aim is to stimulate Philippe's autobiographical memory, so that he accesses more specific, nuanced and active memories. Back in the office, he suddenly remembers a weekend in Venice with Valerie, which he had organized alone for their wedding anniversary. Nothing had gone as planned and afterwards the couple had laughed about it a lot. Philippe suggests this destination to Maeva for their next stroll.
Every day, virtual dog walk. Independently, every morning, Philippe does his routine walking exercises. Standing in his living room, on his treadmill, headset on his head, he walks in the company of Diego, following the virtual reality equivalent of their usual route. Philippe likes this exercise and appreciates being with his dog, even in the form of an avatar. Often, he calls the foster family right after, to ask for news about Diego. Sometimes, they go to New York, to his daughter's neighborhood. Philippe takes the opportunity to pass by Laura's studio.
Tuesday. Immersive psychomotor remotivation. 1 to 2 times a week, Philippe practices immersive psychomotor remotivation, IPR. From his armchair, he stands up without using support, and visualizes in augmented reality images of places in his apartment where he would like to stand. The kitchen window is the goal he has set for himself today. He indeed loves observing his street from this vantage point. Once the destination is chosen, Philippe can select his visual aids. Either simple footprints in which to place his own, or the avatar of Lena, the psychomotor therapist, showing him a safe path, as well as the correct posture. Philippe chooses the avatar, and follows the path at his own pace. He can stop at any time. On Tuesday, he almost reached the window. He will succeed next time.
Thursday, supervised group. On Thursday afternoon, Philippe joins the therapeutic group led by Arnaud. There are 4 participants, each sitting at home. The nurse begins with a round of the avatars and asks everyone to name a victory recently achieved. Philippe announces to the group that he has not skipped any more meals and that he even sometimes enjoyed the contents of his trays. The group congratulates him. Then, they all discuss the theme of what matters. Arnaud highlights the commonalities and differences in their remarks. The group then moves to the activity space for a collective construction exercise. The more they cooperate, the more efficient they are. Throughout the session, Arnaud takes notes, which he will use later to write his observations in the patient files. After a debriefing time, the nurse says goodbye to the group and disconnects, leaving the participants in the refreshment area. Philippe approaches his avatar to Jeanette's and gives her his phone number, suggesting they have a coffee together when he can walk again. She thinks it's a very good idea.
Friday. Neuropsychological assessment. Philippe has an appointment for a cognitive assessment session with the neuropsychologist, Miss Sunshine. She administers a Wisconsin card sorting test to assess his cognitive flexibility. She then suggests he carry out several missions in the virtual kitchen. During the activity, his behavior is observed and different measurements are taken in real time to track the evolution of his cognitive abilities, such as short-term memory, attention maintenance, planning, or inhibition. The results are rather good.
Samuel reviews all the caregiver's observations and congratulates Philippe for his commitment. He announces an upcoming reduction of the program. The story ends well. Indeed, some time later,